Welcome back to another episode of Bad Girl Gone Good podcast. It's your host, Visionary A. Let's tap in. So, it is Nurses Week, hence the nurse wear, It's Nurses Week and Mental Health Awareness Week, hence the green. So today, I have on a very, very special guest that I'm interacting with here on Bad Girl Gone Good podcast. It's one of my friends, one of my colleagues. I've known her for over 13 years. We went through those nursing school trenches together, okay? Whenever we needed a house to go to, whenever we needed a good joke to be told, or just a shoulder to cry on, because a lot of that happened in nursing school, this was our go-to. Her specialty is cardiovascular and lung nursing, okay? Like, that's a lot for me to fathom at this point and to explain, but her expertise carry her into the career of cardio and lung transplanting, okay? So she is an expert in her area of nursing. So I would like to introduce to you guys Nurse Han G. Welcome to the show.
Hi, everybody. Thank you for having me.
So how has everything been specifically in the advancement of your career?
It's been a journey. I started in a small community hospital, was right when we graduated. So it's almost 8 years now.
Yes.
So I started at a small community hospital. I'm now at a big hospital, one of the most prestigious in Chicago. So I'm a cardiothoracic and vascular nurse there. Like you said, I deal with heart transplants, lung transplants, open heart type surgeries, cabbages, things like that, revascularization, lung, all that. It's a lot. It was very intimidating coming from where I came from because I was a tele nurse at first, and now I'm an ER nurse, still an ER nurse as well. But it was a lot. It was a lot. Mm-hmm. It was intimidating, like I said, going from a small community hospital to a big university, and me being a brown girl, and there's not that many of us there. I got called the secretary often. So when I first got there, I was like, oh, okay. Like, at least they didn't get me mixed up for environmental services cleaning and something like. But yeah, it was intimidating, but I've adjusted and I love it. And I feel like I'm going to be there forever.
I know, right? So that's funny that you said that, the mix-ups. I get that a lot too. They always think I'm a tech because, I'm a brown girl, black girl, and I'm young and I look, pretty youthful. So when they see me come in, I'm like, yeah, but I'm an expert psych nurse. I've been doing this for a long time. Yeah. So definitely understand you on that one. Right. So what is one of the biggest differences that you've experienced working in a smaller hospital versus the hospital that you work? I mean, I know you still work for both of them, but what are some of the biggest differences that you see?
The resources. And it's just like at the university, we don't have to worry about literally anything. Mm-hmm. Something's not stocked, call them. Boom, it's right there. I obviously during the pandemic, that was a different story. No one had PPE. Yeah. But and the Southside Hospital, we don't have it. We got to make it work. We got to find something. We got to limit the usage of it. And it's just, it's sad to see the difference, But like I was saying, I feel like I'll always stay there because I feel like I can make that difference. And it's like, like that toxic ex that you just keep going back to and you think you're going to change them. I feel like I can make that change at that small Southside hospital.
I definitely understand that for sure.
Yeah. So it's very different. It's the community of the hospital. Like I can speak to the director of nursing on a daily at the small community hospital. At the big university, I don't even know what they look like. Mm-hmm. And I've been there for 6 years. So it's just real small. You talk to the cafeteria people like, hey, what's up? By name. The security guards by name. So I love it. It's like a more family-oriented feeling, but I like it a lot. Mm-hmm. It's sad to see. It's like I said, it's like I feel drained every time I leave. I feel defeated.
Yeah.
But I keep going back.
I know.
I keep going back.
So it is so interesting that you have equated going back to this small community hospital, lack of resources, for a couple of reasons, right? You equated it to going back to the toxic ex, knowing, the dynamics of that relationship, but also feeling like you can do something about it.
Mm-hmm.
But then recognizing that when you leave, like, I'm drained, like, I got to go replenish, like, what am I doing? You know what I'm saying? Mm-hmm. So that is an interesting aspect of how we operate generally as humans.
Yep.
I would like to say as women, but that's a falsity. It's us as humans. We have that savior complex.
Yes.
And that has been embedded in us, for generations through our traditions, our family and the way that we operate within each other. So, I definitely understand. And I think that is possibly one of the reasons why I work the way that I work as well. We can go back and forth to different environments and settings, but we always find ourselves in interactions or transactions as far as in nursing, in our careers, where we need to give from a place of like, I just know, like, I can do this thing, So my question to you is, okay, the first question I have for you, what is one of the things that you could probably like pinpoint within that setting that you feel connected to in a way that you want to give back, like that, what keeps you coming back?
I was born and raised on the southeast side of Chicago.
Okay.
So I was told in high school that I wasn't going to be nothing. Mm-hmm. I was going to be nothing, right? By counselors and educators and my teachers who I'm supposed to look up to. Mm-hmm. And so that kind of like, actually, instead of making me feel like I wasn't going to be nothing, it made me want to prove them wrong.
Yeah.
And go to school and do something. And I just feel like if my teachers are telling me these type of things and educators and counselors are telling you these things, like, all these other little kids are being told things like that too, and they lack the positivity and the education. And education to me is a big thing. And that's what I want to go back and get my master's in is education.
Okay.
But working at the South Side, I feel that that's what they lack. They're not educated when it comes to the disease process, when it comes to just their health, when it comes to even just getting basic checkups. They don't know that. They don't know that they're supposed to do this. They don't know just the basics. And you think that it's like, man, it's sad because you're educated and you think little things like washing your hands daily, like every time, like I'm saying, like when you're in the bathroom or doing little things that we do that we think are just come to us and they're normal. It's because we're educated and we know better, but they don't. And I feel like when I'm there, I'll actually sit down with my patients and I talk to them about their disease process. And they don't know, like, let's just say, for instance, someone that has congestive heart failure, right? You're not supposed to eat a lot of sodium. If sometimes you're on a fluid restriction and they think, well, I didn't drink that much water. All I drank was coffee, this, and that. That's fluid, any fluid, and they don't understand that we love ramen noodles, right? They be eating 2 things of ramen noodles a day. That's enough salt for 4 days. You know what I'm saying? And they don't realize that. And like, oh man, I eat it every day. My legs swell up. And it's like they come to the hospital when it's a problem.
Yeah.
Where it's already too late to try to fix it. Like they could have adjusted their diet and a little bit of exercise and, things like that. But they don't know that. Like they just think, oh, my legs are swollen. It's fine. And then they don't come back to the hospital or come to the hospital till they can't breathe.
Yeah.
And at that point, it's like, okay, now you got to be hospitalized. Now we got to diurese you. And now you're going to be here for a little while. And they don't want to stay and they don't know what's wrong. And then they think we're starving them because they can't eat or they can't drink. And at that point. So it's like, the education, we just don't have it on the South Side. Like I said, I went to school on the South Side too. Like, if my teachers are telling me this, what are they telling everyone else around the city? You know what I'm saying? So it's sad to see, but I like to be a part of it and think and hope that I make a difference.
So that's a very interesting story, and it's interesting insight because when I was probably like in, I'm gonna say first grade, I had a teacher tell me she was the closest thing to God that I would ever see. That was deep, right? Because, a lot of people say, yeah, my teacher told me I wasn't going to be this, so I wasn't going to be that. My teacher told me she was the closest thing to God that I would ever see. Now, like you, I made it a point to prove her wrong.
Yeah.
So moving on, But yeah, that's interesting how a lot of our foundation of how we move forward in life is based upon a lot of things that we hear and what nurtures us. And a lot of the times that's when we are at school. So yes, education is so important. So with that, with you being able to identify that deficit, like in the community, even before people are sick or have the deficits, like tracing it all the way back to even the education that we receive, what is like something that you would like randomly like from us having this conversation, what do you see that would fit into this community of that cycle that could probably like stop that cycle from, revolving? What could be done, whether it's resources, whether like what type of resource or what type of system would you put in place?
I think there is a lot of systems already that the kids don't take advantage of it. Like in this education wise, like for school wise, but like in the community wise, when it comes towards like the hospital, like maybe throw in some type of, what do they call it? Like screenings, and then like having a cookout for the community, like have the hospital host it and, maybe do free screenings, check blood pressure, maybe do the basic labs and just hand out flyers and educate them like on food groups and things like that. Because a lot of people drop out of school early and they don't even get to that point where they're learning about what to eat and what's good for you and learning the basic food groups. Like as an adult, you don't remember that from grammar school, you're just like, oh, this is what I eat and it's healthy. This is what I got. It's like, no, that's not really healthy. Like, but you're trying. But like if they knew the difference, because they're like, oh, I eat my vegetables. Okay, what kind of vegetables you eat out the can? What's the canned vegetables are full of sodium. So it's like if they knew the difference, like I feel like just little things like that to do in the community would be good. Like just showing face and just teaching, like offering free things like that in the community. I feel like people will actually attend it.
Okay. So with that, I'm going to call out some healthcare professionals, some nurses that are going to watch this podcast, some social workers, some therapists. I think this conversation calls for a bit of community organization. Would you agree?
Yes, I agree.
So yeah, because, we learn about these things in school, but we don't really focus on those things because we're trying to graduate. We're trying to study, get those exams done, trying not to fall apart and have meltdowns, trying to graduate and finally get a job.
Yeah.
So, we get excited about finally getting a job, making us some money, and once we finally get to a place where we're having these conversations, we're experts at this point in whatever specialties that we're in. We've been in the game for over 5 years. When you're at 5 years in, you're considered an expert. So now we're past that mark and now we're in it. We're in the culture and we get to see like all around the board and like what's really going on. And I think this is probably a good place to begin, with nursing being our foundation and how we go about nurturing ourselves and nurturing other people. Just having those real conversations about how to get the resources that are valuable to the people and what is actually required. Because you said something really profound, which is the resources are there, but people don't really take advantage of them, So I think a question that's up in the air, like we said, not even a question because we probably addressed it a bit, but which is community organization of how to get the people to the resources.
Yes.
And making sure those resources are utilized so they don't go back to where they came from. So it sounds like, nurses, healthcare professionals should and ought to put into place whether they or we are. So let me stop myself, because I was just about to get into organization on our part. But then, of course, you have the hospitals and those organizations. One thing that I've noticed is it's not that easy to organize with hospitals on my end. I've tried it from the perspective of having a double profession. So, for example, I'm a licensed cosmetologist and a registered nurse working at a specific hospital that I worked at under a specific system, which is behavioral health. I noticed something when I was working with children in behavioral and mental health. So I was working on a unit for a time. I floated all over the hospital, but there was an issue that was occurring where the kids, because kids need placement, and so it's hard for kids to get placement, so they're stuck in
For a long time.
behavioral health hospitals for long periods of time, right? So there were lice outbreaks. So, of course, Black people got this thing where Black people can't get lice. False. That is false, okay? Black people can definitely get lice. I'm a witness. I treated it on more than one occasion, okay? So my patients were getting lice. And so they, of course, people know, who know me in the hospital administration, all of that good stuff. They were come to tell me because they actually had a place outside of the hospital that they were taking the kids to, but it was a Black girl that finally had to go. She has curly hair. And when a Black girl with curly hair gets lice, you have to cut it. This specific place was not a licensed cosmetologist. It was just like a lice treatment facility. So they had drenched her in the whole lice stuff, all of the chemicals and all of that, but had to send her back to the hospital without the full treatment because the service provider was not a licensed cosmetologist. Okay. They call me. So I do the assessment. I perform the service inside the hospital. Couple of things that I've noticed. I did it so I can be able to take inventory of actually what these kids need. So I saw I had to do it in a public space in the hospital. Dangerous. You can't do lice treatments in, open spaces, areas, of course, they needed specific type of wash basins, they needed specific types of trash bags and everything to just keep all of this stuff safe so it wouldn't spread. I had to deal with the linen and all of that, just performing the entire service. And of course, I take it to my administration, let them know the ins and outs of what this will cost on a, regular basis. I even set up a reward system because, outside of the kids being there, behavior becomes an issue. It becomes an issue because they're there for so long. So some kids may get into fights and just misbehave, just natural stuff that occurs with kids. So I wanted to utilize the hair care system as an incentive for good behavior, but also as a natural, a reoccurring system, because hair care is a part of self-care.
Yeah, so they
especially with any girl, any person, I even emphasize the fact that, hey guys, when y'all don't got y'all hair cut, how y'all feel? How y'all acting? So I wanted them to understand how important that is for children, kids, impressionable people, to be able to look and feel good. So it can have those types of effects on their behavior, which would in turn allow them to have better, longer term behavior and possibly get placed sooner, So through that situation, I found that it was like really hard to partner with this facility that I was at. They made excuses about the money that they didn't want to spend, all of that good stuff. But I like to say behavioral health and mental health and psychiatric health makes some of the most money in the healthcare system. Okay? No matter where you are across the United States, across the world, psychiatric, behavioral health, and mental health makes the most money. And it's important for us to have these conversations so we can understand how our resources as tax-paying individuals are being utilized and how our children who have to face some of these systems need to be able to utilize these resources. Okay? So with that, have you noticed any differences or any like goals or no's in trying to maybe organize or partner with any facilities that you worked with?
As far as the one on the south side, I feel like they will, but like you said, it's going to be a pushback. Like, okay, how are we going to do this? Who's going to fund it? What are we going to do? Like, where are we going to get the money to do this? It's always about the money.
Yeah.
They got money for the things that they want to do, but when it comes to suggestions or anything like that could possibly better, it's like, oh, I don't know if we're going to make that's in the budget and things like that. You know, I'd go in there on my day off and run it, you know, but as far as like the donations and who's going to be there for take the blood pressures, it can't just be one nurse, you know, you got to have other volunteers too. It got to be, like you said, the nurses coming together and organizing it as well. But as far as the hospital resources, you know, that's where the problem's going to be. I feel like it's anywhere. It's going to always be about the money. But like you said, that you doing that for those kids, it'll give them something to look forward to. It'll give them an incentive to behave well. Because guess what? I'm gonna get my hair done. I'm gonna feel good. When you get a haircut, you feel good.
Yeah,
you know when guys get a lineup, they feel good. You got fresh braids, you feel good. You know, so yeah, things like that. It's sad that you get that pushback because for something like that in the community, just to have people come get screened for your blood pressure, just some basic labs and educated on what and what not to eat. Like it'll take 10 minutes per person. You know, it'll be easy. But as far as it goes, like how are we going to run the blood? Who's going to take the blood pressures? Who's going to be out there? You know, how are we going to get it out into the community?
Yeah.
How's the community going to know? You know, like let's get Chance the Rapper.
I know. Right?
Come on, Chance, you got some nurses.
Right?
But, you know, like to fund something and throw something, you know. So I don't know. It's hard. It's always about money though. And that's what it comes down to.
So yeah, so over the past couple of years, I actually like started going back to school. We know that can be daunting when you have a full-time job. So I'll go get some of my education, take me a little break. One thing that I've learned in my most recent past courses was how to research and find money. Specifically for things like this, you know, I learned how to navigate some of the governmental websites and all of that, like just how to search things, seeing what's coming up, all of that good stuff. So I've learned that the resources are there, but people have to be on the learning curve of what's coming forward and what's coming out to be able to even have access to those things. Now, what I do see from this conversation is that, of course, it'll take like more than two people. It's going to take like a real organization for even that to occur. Like someone would have to be in charge of finding the funding. Some of us will have to be in charge of organizing the events and facilitating the events and getting nurses who will be on that rotation and things like that. So these are very good conversations to have because it gets our gears grinding, you know, so we can know exactly how we can do that thing we were talking about earlier, like going back to that place, feeling like I could fix it, you know, but really having some real thoughts about what people need and tangibility of how to make that happen, you know. So this was good. That's good. So my question to you is, I know that what kind of nursing you do now. So do you plan to continue in this specialty? Do you see anything else in your future? What does your nursing career look like within the next couple of years?
I feel like I do want to go back for my master's in education.
Okay.
Yeah, so once I'm retired from bedside, I want to go back and be an educator.
Okay.
I feel like what we went through, you said the trenches. I just feel like I could make nursing school good for people, for the new generation, you know? Like, I feel like I could be a good teacher that makes a difference as well. Like, our teachers, it was more of a weed out.
Yeah.
Like, they were trying to weed everybody out. Like, get out the guppies, you know what I'm saying? Like, get them out, get rid of them. But I would like to be like, what do you need to get through this class? What kind of help can we give you, or how can I explain it to you in a way that you're going to understand, so we could all move forward and you could progress through this program. Not you guys ain't doing it, you guys are out.
Yeah.
Like, figure it out on your own. And it was mostly figured out on your own, because half them teachers were not teaching.
For sure.
So I feel like that. And then, like I said, when it comes back to the community, offer things like that, like to be educated. And I just feel like maybe that I am destined to be that, because I do like educating people on their health, you know? So that's what I see myself doing.
Yeah.
When I retire from the bedside, but that's going to be a while. But I just want to get the schooling out the way, because I've still got a young mind and I can retain the information. I don't want to wait later to go back to school.
Yeah, I can definitely see that for you, being an educator. Like, you're so cool, so calm and collective. You know ways to put things so people can get the stuff and they feel comfortable with you. So that would definitely be a good school educating environment for sure. Now, with you wanting to go back into education in the future, with the way that technology is today, you know, we had AI,
Chat GPT.
Yes. We have all of this technology as far as the streaming services, everything, you know. Even keeping in mind the community service portion of it, what ways do you think could help people, like, through nursing with utilizing some of this technology? What do you think could be done?
A lot. I don't know. Like, I feel like it's very helpful, like, for the nurses to now, like, you could literally just say, tell me all about an LVAD.
Okay,
like, ChatGPT will tell you what an LVAD does. Like, it's, it pumps for, all that. It'll literally break it down for you. So I feel like it's easier, because when we were in school, YouTube helped me. There was this one guy on YouTube. Oh my God, I forgot his name. I would say it, but I forgot it. But we would watch his videos over and over, and that's what helped me, because I'm a visual learner, so he would write it down on a board and break it down, and I got it, as opposed to just reading off the book like our teachers did half the time, or even told us, go ahead, read this page, I'll be back.
I'll be back.
And leave, like, what? So I feel like it's beneficial for them. Like, it makes it easier. I just hope that they're actually retaining it and not just saving it for the test, or, you know what I'm saying, like, looking it up for the quizzes and stuff like that, and they're actually retaining it. But I feel like those beneficial for them. They got it easy.
Yeah. I could definitely see a nursing ChatGPT app.
Yep.
Just saying, you heard it here first. For nursing school.
Yep.
That would be cool. Even being able to educate people in the community. Because it's like, people won't know anything about their diet. They won't know their blood pressure. They won't know their last AccuCheck. They won't know so much about themselves, but people have cell phones. Everybody has a cell phone. And so I just know that even if a community organization is not able to be, like, out in the community or mobile, right? Having some technology that people can take with them and have access to, like, nurses communicating with them, about their specific disease process or general stuff will be so beneficial. Another question. From your perspective of the patients that you deal with, how would you rate or could you rate the level of mental health or mental illness awareness and just the happenings within your community? Like, is that prominent? Is that a prominent thing?
Very much so.
Okay.
And it's sad to see because they don't have the resources, or don't know where to go. Sometimes I'll get a psych patient, and if we only have geriatric psych at this hospital. So if these kids are or if it's a kid or an adult, a young adult under 55, we have to find placement for you.
Mm-hmm.
So they'll be off their meds because, again, they're not following up with their doctors, or their doctor's too far, or they don't have a ride, so they don't get their prescriptions refilled because they have to see the doctor so many times to get your prescription filled. And they just don't, right? So they'll come in when they're having a breakdown, and most of the time, they're coming in by the police or the fire department because someone saw them doing something. They were on their last leg, it's just awful, So they come in and then they're sitting in the ER for days because we have to find somewhere to send them. And then who knows how long they're going to be sitting at that place, But if we just had, it's awful with the mental health. We get kids that are super young. There was a girl. I felt so bad for her. She was such a beautiful girl. She looked like Coyle Ray. What's her name?
Coyle Ray.
Yeah, she looked like her. And she was just so sad. She was in school for law. She came back here to visit her mom on break, and she was a cutter. And she said that she's been a cutter for all this time, for years, since she was 10. And I'm like, oh man, why? You got a lot going for you. You're such a little pretty girl. You're in law school. You're going to school pre-law. And I'm like, you got a lot of things going for you. And then I saw her mother.
Oh yeah, and then explained a lot.
It explained everything.
The roots. Yeah.
Her mother didn't even, as she was bleeding, it was a deep one, left her to go outside while we were still trying to figure out what was happening with her. Left her, didn't come back for 20 minutes. And I'm like, okay, you're bleeding and you're still not getting the attention you want from her. So I get why I get it.
Yeah.
You did that for attention. She said she hasn't did that in a long time. She comes back home from college and she did it again.
Okay.
So it's just things like that. So the mom, that little girl needed psych help. The mom needed it too.
Right.
You could tell the mom needed it too. Yeah. So it's just they don't know what's wrong with them. They don't know why they're snapping or why they're always having these altercations with people or, just snap within a second, because something's wrong with you mentally, but you don't know that. You know what I'm saying? Yeah. So, and you don't have the resources, even if you did know it, to get it taken care of. Yeah. You know what I'm saying? Or you're scared of it. Because our people, Black and brown people, don't want to go to therapy. Okay. You don't need therapy. God, read the Bible. Go to church. You don't need therapy. No, I do.
No, I do. And I do too.
And I'm going every week. So, it's just, we don't realize it's just trauma, generations of trauma. And it just gets passed down. And we don't realize it. Sometimes you just don't realize it. I realized something was wrong with me too, and I had to go get help. It ain't just always other people.
Absolutely.
You know what I'm saying? I needed to heal, and I'm on my healing journey now, and I love it here.
Yeah, exactly.
But people don't know that they're hurt and that something's wrong with them.
Yeah.
And it just gets bigger, and then it goes down to generations, and then we don't realize how it affects their children either.
So you named a couple of profound things. First of all, the resources in mental health. And being able to even identify if something is up with you and being able to have those constant interactions because those people that what you just described, that's a tender kind of situation. So oftentimes those people need more interaction than some others, And so I think again, some technology would be great for those kind of people, being able to correspond with a nurse behind app that can be able to walk you through certain things or whatever.
Emotions.
Your emotions, right? So that's one thing. The resources being able to, I see that in the future, having an app where we can definitely deal with those real deep rooted mental issues that people often have, that can show up in what people consider taboo behavior, wild behaviors, but is more prominent than what people could ever expect or think, right? And so over my time as a mental health professional, behavioral health professional, and spiritualist, I got to see just that thing that you said, that when someone shows up in front of me, is often someone directly in correlation with them that is either the cause of it, they have the issues as well, and it's like usually passed down, and so I have a practice where I call trauma tracing, where I can just sit with a person, do an interview. I've gotten good at being able to track the root of the issue and energetically where those issues occur. Because like you said, we get told, go sit down, go read the Bible, go to church, but we tend to bypass the fact that we are spirits having a human experience. When something traumatic occurs, our spirit is broken first. Just like we talking about what happened in school. Those teachers, those counselors, those people who are supposed to be nurturing to our spirits, they tell us stuff that's settling our spirit. Is like, whoa, like that wasn't a punch in the chest, but it felt like it happened to your energetic body, and that's something that you carry with you. You ain't got to carry it in your arm, but it's in your body. You feel it. And so when we have those interactions, whatever type of trauma that we experience, we are carrying it in our energetic body. And that's what's passed down to us through birth, literally in our waters, in the amniotic fluid that's passed to us, coming from where we come from, literally. And so the work that I've learned to do is how to help people unpack what's in their energetic body. So you get to unpack the load that you're carrying, so you can be able to consciously and healthily let it go. But we know that as nurses, as healthcare professionals, that when we help people through certain things, if we don't replace it with good behavior, if we're talking about behaviors, or if we're not telling them take this away, but add this, then you left with a void. And oftentimes that old stuff can creep back in and settle back in. And so the work that I do with people, I help them unpack it, cleanse that energetic area, but replace it with the truth. So the truth comes with words and with action. So just imagine if, we was back in 3rd grade and someone said, hey, I see you being the top of your class, being a healthcare professional, and the way that you interact with people, you're going to be a teacher. Like, that's in you, and here is some resources, an article, a book on this or that, or this and that. And when you come back here tomorrow, I want you to tell me what was the topic of that book. What? You spoke life to me?
And your word is impeccable. Be impeccable with your words.
Resource to ignite me, and you gave me some engagement. You put something in my spirit that I'll never forget. And so that is what we do as nurses, and that is what we're leaning toward as we go on our healing journey and we help other people do. Okay, so would you say that, like, moving forward, you could possibly see yourself like conjuring up some more community organization, or seeing how funds are rolling in and stuff like that?
Definitely. I want to look into all that, where you said there's money out there, and show me how to get it.
Yeah. That's definitely. That's what these conversations are for, because as y'all can tell, possibly, you probably can't tell now because we are so professional and refined now, and we just do our great jobs. But we have a profound history of how we've helped each other get through so much, through some profound times in our life. Like nursing school was do or die, and then we were faced with so many things, whether it was money and relationships.
Oh, God.
That we had to just help each other through. So I'm glad to be able to convene all these years later so we can know that we're on the same frequency of importance of what we're putting into ourselves, the self-care that we give ourselves, because we was able to recognize, where we came from, what was given to us, but how we wanted to change that trajectory of our life.
Yes.
Okay. So this has been a wonderful interview. Thank you, Hanji, for coming on to Bad Girl Gone Good podcast. So get comfortable. Tune into our evolution because we just got here. If you enjoyed this episode and you're interested in healing services, any products, collaborations, or just simple consultations, visit thespiritualhealingcompany.com.